With that said, as always, we like to start our calls with a message from our leadership, and joining us today is our Executive Director, Christine Kleckner. Welcome, Ms. Kleckner.
Thanks, Jim. I mentioned this during our last town hall, but do want to share again for those who may have missed it. In December, our VA Secretary, Doug Cullens, met with all VA hospital directors to share his vision for a VA reorganization. The Secretary's focus is on placing veterans at the center of all operations, streamlining management, and ensuring resources reach frontline staff. The reorganization is a significant 2-year process. It will not be an overnight change and will involve ongoing updates and support for all employees affected at various organizational levels, primarily VA central office and our regional VISN sites. VA does not expect a significant change in overall staff levels once it's complete. The Secretary's goal is to simplify our organizational structure so it enables us to continually improve quality and patient safety, ensure continuity of all VA care, and continually improve quality of care outcomes. We will keep you updated as we move forward with this reorganization. We have a lot to look forward to in the near future. As we shared during our last town hall, we acquired land for a future Fisher House. For those unfamiliar, Fisher Houses are a home away from home for military and veteran families traveling from out of town, looking to care for their veteran receiving care at or coordinated through the VA. A Fisher House eliminates the burden of paying for hotel rooms, meals, and other essential needs for an unknown amount of time, while a family member is acting in a caregiver role for their veteran. We secured land at the northeast corner of Nursery Drive and Deming Way in Middleton, Wisconsin. We've been finalizing permits and will be doing some site preparation before turning it over to Fisher House for construction of our new 16-unit house. As you know, construction schedules can shift based on many factors, but we are hopeful to break ground in or around early July. We will keep you updated on the groundbreaking, ribbon cutting, and future opportunities for community support as the project moves forward. Last week, our leadership team proudly called our next Hall of Heroes inductee to inform him that he was selected. U.S. Army Staff Sergeant Thomas Hack received a Bronze Star and Silver Star from his time serving in Vietnam. We'll work with him and his family to find an induction date close to Memorial Day, so hopefully you can join us in celebrating his heroism. And lastly, we are excited to share that this coming September marks our 75th anniversary of providing care to our veterans. We've been digging through old photos and newspaper clippings, and we can't wait to share those with you starting in September. We'll be having a celebration that we hope you can attend, so be on the lookout for more details as we get closer. As always, thank you for joining us today and for your service.
Thanks, Ms. Kleckner. There's a lot to look forward to over the next several months. Hopefully you all can join us for our upcoming events. And this is also a great time to remind everyone to check our Facebook page or sign up for our email newsletters. You can find a link to both by going to the Madison VA website and scrolling down to the bottom of the page. But if you check our Facebook page out earlier this morning, we posted that video of our leadership calling to inform Staff Sergeant Hack of his induction, which is very touching if you get a chance to check that out. Switching gears, we've got some other resources for you if you need help with your online account or if you need more information about all the veteran benefits you've earned. Here to tell us more is one of our nurses and also an Army veteran, Karen Bulkey.
Hello, this is Karen Bulkey, RN, and I work in primary care. And thanks, Jim. I really appreciate this opportunity. I have a few opportunities for veterans and caregivers that you might find helpful. As you probably know, sign-in for your My HealtheVet account changed last year. If you need help with your account or if you just don't feel comfortable with technology, we have a My HealtheVet expert to help. His name is Jeff. He's been touring around, visiting each of our clinics and plans to do this regularly. No appointment is needed. Just drop in for hands-on assistance with managing your medication, viewing lab results, how to securely send a message to your primary care team, and much more. We've been sending emails to those of you with a valid email address informing you of when he'll be at your local clinic. But you can always contact your local primary care clinic to find out when Jeff will be visiting your clinic. Another resource we started offering again is an orientation to introduce you to VA resources. We know that when you separate from the military, trying to understand all those resources and services available to you through the VA and throughout the community can be overwhelming. This orientation provides you with a deeper dive into your healthcare resources. Whether you're a new patient or if you've been using VA resources for a long time, it's always good to get a refresher to make sure you're taking full advantage of all the benefits and resources you've earned. And the best part is that we offer it virtually, so you can join us from wherever you are. We invite you to join us on the fourth Monday of every month from 10 a.m. to 11:30 a.m. for this virtual class. We'll walk you through VA resources and answer your questions. That means our next class is Monday, March 23rd. Again, that's the fourth Monday of every month from 10 a.m. to 11:30 a.m. You can find a link to join the meeting by visiting our Madison VA website and clicking on Events to see upcoming dates. Or you can ask your primary care staff for more information. If you can't join us for orientation, you can still get all of the information, as I mentioned, if you go to the Madison VA website and click on Events. Not only can you find a link to join the orientation classes, but you'll also find a link to the VA resource booklet. This 2025 resource has information about the Madison VA hospital and clinics. It also includes information about all 3 VA branches, the Veterans Health Administration, the Veterans Benefits Administration, and the National Cemetery Administration. We encourage you to download this information to your phone or computer, so you'll have it at your fingertips when you need it.
Thanks, Karen. Before we move to our next presenter, we'd like to ask a few polling questions about our orientation to give us an idea of the interest level. You'll use your phone keypad to answer. The first question is, after learning about our resources that Karen just presented, are you interested in our new VA resource guide? Press 1 on your phone. Don't accidentally hang up on us. Press 1 on your phone if you're interested in getting this resource guide. Press 2 if no, it doesn't really interest you. Again, after learning about our resources that Karen just presented on, are you interested in our new VA resource guide? Press 1 if yes. Press 2 if no. They started the question a little late, but we've got a lot of people voting right now, and it looks like about 84% of you are interested in it, so hopefully you have that information on where to obtain the guide from our website. Thank you for that. The next question is, after hearing about our orientation that we offer, introducing you to VA resources, are you interested in attending a Madison VA Healthcare orientation class? Press 1 if yes, you are interested in attending an orientation in the future. Press 2 if no, it doesn't really interest you that much. Looking, got over 200 people chiming in, and it looks like about 63% are saying the orientation doesn't necessarily interest you, but 37% of you, over 100 of you, say yes, which means that a large chunk of you are more interested in receiving the actual guide itself. But for the 100 of you that are interested in it, we hope you join us on the fourth Monday of one of our upcoming months of our orientation class. And the last question, for those of you who are interested, and really even if you're not interested, if you can kind of give us an idea of resources, when they're available, what time of the day works best for you. I mean, there are three options here. If in the morning, say before 11 a.m. is the best time, press 1. Press 2 if the afternoon is the best time, and we will say that the afternoon will be from 11 a.m. to 5 p.m. And press 3 if the evenings are better or after 5 p.m. Again, for those of you interested in the orientation class or even for any resources that we might offer, when is the best time of the day for you? Press 1 if the morning before 11 a.m. Press 2, 11 a.m. to 5 p.m. Press 3 if after 5 p.m. And we are showing about 46% of you like the morning before 11 a.m., 42% of you like 11 to 5 p.m., and 12% of you like 5 p.m. or later. So we have a lot of early birds on the line. Thank you all for providing us that information. That helps us as we move forward with planning our services. Next up, we have a program that assists veterans with home improvement issues. Here to tell us more is Crystal Boylan from our Occupational and Recreational Therapy team.
That's right, Jim. The program is called HISA, which stands for Home Improvement Structural Alterations. This program provides funds to eligible veterans for medically necessary improvements or structural alterations to the veteran's primary residence. The home improvements and structural alterations must improve access to the home or to essential areas of the home, like a main bathroom. The home improvement or alterations must be medically and physically necessary for the veteran. That medical and physical need must be associated with a permanent condition rather than a temporary condition. For example, a veteran may be unable to step over the bathroom tub due to hip pain, but has hip surgery planned. That would be considered temporary, so that would not be a permanent condition. For HISA funds, it would need to be a permanent situation. So you may ask, what is considered an essential area of a home? There is more information online if you're interested, and I'll share that information shortly, but generally speaking, the home must be the veteran's primary residence. Access to the home is defined as the ability to safely enter and exit the home and to safely move to at least one bedroom and one essential bathroom inside the veteran's primary residence. Veterans often use funds to improve bathroom accessibility, but we've also seen them used for interior or exterior railings to safely navigate stairs, improving access to the house, or improving plumbing or electrical systems necessary to support life-sustaining home medical equipment, such as a ventilator. Again, these funds must be used for improvements that are medically and physically necessary. They cannot be used for routine home repairs or for altering the structure for convenience or comfort. If eligible, the amount of HISA funds a veteran receives is based on service-connected disabilities. There are several steps in the process that you can find online, but if this is something you or someone you know might be interested in, the first step is for our occupational therapy team to do an assessment of the veteran's medical situation and their physical and environmental needs. For more detailed information about requirements in the process, you can search online for VA's HISA program. Again, that stands for Home Improvement Structural Alterations, spelled HISA. To be evaluated, contact your primary care provider and request an occupational therapy consult for a home safety assessment.
Thanks, Crystal, for that information. As we always say, even if you don't need that resource or it doesn't apply to you right now, it's still good to know about it so you can help other veterans get the assistance that they might need. So make sure you keep that information handy for them. Next, we're switching gears to research. Welcome in Carly Culver from our research team, and she's also a spouse of a Navy veteran. Welcome, Carly.
Madison VA has several research studies underway and in planning. I'd like to share an opportunity to participate in a study for those with cirrhosis, Even if you aren't able to participate, please keep it in mind for your fellow veterans. Madison VA hospital and clinics are currently working with 46 other VA medical centers on a research study titled Preventing Liver Cancer with Ultrasound versus MRI, or the Premium Study. In this study, we are comparing two imaging tests, ultrasound and abbreviated MRI, for screening for liver cancer in patients with cirrhosis. Ultrasound is the standard recommended screening imaging test for liver cancer in patients with cirrhosis. Abbreviated or shortened MRI has not been used for liver cancer screening. Therefore, it is not the standard of care, but shows promise for early detection of liver cancer. These two tests have never been compared in a large study. We hope to learn whether screening for liver cancer with abbreviated MRI can reduce liver cancer-related deaths in veterans with cirrhosis who are at a higher risk for developing liver cancer. We also want to see whether they can detect cancer at earlier stages and whether detection of cancer affects treatment options. You may be eligible for this VA-funded study if you are a veteran aged 18 to 75, have liver cirrhosis, and are interested in getting screening for liver cancer at VA. This study will involve traveling to Madison VA every 6 months for imaging, blood tests, and answering health questions for up to 8 years. You will receive $45 for the baseline visit and $25 for every imaging test completed. You may qualify for travel pay for these clinical research visits. Please ask us for more information. If you're interested in learning more about this study, please call the research team at 608-256-1901, extension 12626, and mention the Premium Study. If you reach our voicemail, please leave your name and number, and we will get back to you as soon as possible. The number again is 608-256-1901, extension 12626.
Thanks, Carly. That number one last time for the Premium Study, 608-256-1901, extension 12626. Next up, we welcome Katie Beck from our suicide prevention team, who will share information about a VA telephone app that may help you when you need it the most. And she's also an Air Force veteran herself. Welcome, Katie.
Good afternoon. My name is Katie Beck. I am the Community Engagement and Partnerships Coordinator with Suicide Prevention. I wanted to take a few minutes to share with you a free resource from the VA that's a real lifesaver. It's called the VA Safety Planning App. Tough moments can happen. Stress, anxiety, depression, anger, and isolation. We are human. For many of us, those moments can hit hard and fast. The VA Safety Planning app is designed for exactly those times. It helps to create a plan so when times are tough, you don't have to worry about what to do. This app will help you create a personalized safety plan built for you by you. It's not a generic checklist. It's something that reflects your own warning signs, your own coping strategies, and the people and resources that matter most in your life. This app walks you step by step through building a plan that works best for you. It will also help you identify your personal warning signs, the thoughts, feelings, or behaviors that let you know a crisis might be building. That awareness alone can make a big difference. Next, it will help you identify coping strategies you can try on your own, things that have helped you get through tough moments before. That could be going for a walk, listening to music, breathing exercises, grounding techniques, or anything that works for you. Then the app moves into distractions and support. You can list places you can go to distract yourself and list friends, family members, battle buddies, or trusted professionals, the people you can reach out to when you need help. With just a tap, you can call or message them directly from the app. It also includes the Veterans Crisis Line. If you're ever in immediate danger, help is right there with no searching or guessing. Another important feature is means safety. When you are struggling, how will you keep yourself safe? The app helps you think ahead about ways to make your environment safer during high-risk moments. Small, practical steps that can reduce risk when emotions run high. One of the best features is the app works offline once it's set up. You don't need Wi-Fi or cell service to access your plan. It's private, secure, and always with you on your phone, whether you're at home or in the community or traveling.
And I want to be clear about this. Using the VA Safety Planning app does not mean you're in crisis right now. Many veterans use it as a preventative tool they set up during a calm moment, so it's ready if they ever need it. Having a plan helps you remain in control of what happens, even when life is feeling out of control. If you're receiving VA care, you can also build and review your safety plan with your provider, and then store it in the app so everything is in one place. If any part of today's conversation connects with you, or you think this app could help a veteran you care about, I strongly encourage you to download the VA Safety Planning app. It's free, easy to use, and available on both Apple and Android devices from your app store. And finally, if you're ever feeling overwhelmed or in danger, please remember you're not alone. You can call 988 and press 1 or text 838-255 to reach the Veterans Crisis Line anytime, day or night. Again, you can call 988 and press 1 or text 838-255 to reach the Veterans Crisis Line anytime, day or night. Thank you for your service, and thank you for joining us today, and thank you for looking out for yourself and each other.
Thanks, Katie. That's great information. And as I said before, even if it's information you may not need or want right now, there might be other veterans who you can share it with, so please keep it in mind. We want to go back to the polling for a moment and ask a couple more questions about the safety planning app that Katie just presented on. You'll use your phone keypad to answer. Again, don't accidentally hang up on us. We don't want to lose you. The first question is, to get an idea of how you all use technology, do you have a smartphone that you're able to download an app to? Press 1 if yes. Press 2 if no, either you don't have a smartphone or you don't know how to download an app. Give us a good picture of what technology is being used out there, so we appreciate that. Looks like about 75% of you are using a smartphone, so hopefully you download the app, which you can find wherever you can get your apps, as they say on the commercials. The second question, after learning about the safety planning app, is this app something you think either you or a friend might find useful? There's 3 options. Press 1 if yes, this is definitely an app that you'd find helpful. Press 2 if you're not interested in the app right now, but you may have a friend who might be interested in it. And press 3 if it's just not of interest to you right now. And I didn't open up the polling for that one, so give me 1 second, and then I will repeat the question. Okay, now go. After learning about the safety planning app, is this app something you think either you or a friend might find useful? Press 1 if yes, it is something that you find useful or helpful. Press 2 if you're interested in the app. You're not interested in the app, but you have a friend who might be. Press 3 if this isn't something that you're really interested in. And boy, we are almost evenly split across all 3 answers. So thank you for providing that information. Again, that's the Safety Planning app, if you want to download it or to get more information, or if you want to share it with one of your fellow veterans. In past town halls, we've received many questions about weight management, and with the many advertisements about medications, it can be confusing about how to get assistance with weight loss. But have no fear. We have Kristen Nelson from our nutrition team to tell us more.
Good afternoon. My name is Kristen Nelson. I am a dietitian with our MOVE program here at the Madison VA. The Madison VA is proud to offer a variety of opportunities to support weight management. Weight management is a priority for many veterans, but it's important to recognize that it is highly individualized for each person. We offer non-medication options such as the MOVE program and nutrition programs, which can help you build the lifestyle skills needed to meet your weight management goals. Medications may be an option for patients who qualify. Please note that while medication therapies are available, each has prescribing considerations. Even though you may see many advertisements for medications, it's important to remember that not all medications are available to patients based on national prescribing standards, pre-existing conditions, and available medication supply. For those interested in learning more about what opportunities may be best for you, we encourage you to reach out to your primary care team for additional discussion. If you have specific interest in learning about weight management medications, engagement with the MOVE program is required prior to prescribing any weight management medication. MOVE is a wonderful opportunity to seek engagement with this team of motivated care partners as a first step towards your weight management goals. Some of you may ask, why can't I go directly into taking medication instead of participating in the MOVE program? Medications work best when added to healthy eating and activity instead of a standalone approach to weight loss. Medications also aren't safe or appropriate for everyone to use. MOVE helps you build the lifestyle skills that make any future medication safer and more effective, and it sometimes leads to enough progress that medication is not needed. To try the MOVE program, contact your primary care team and ask for a referral to MOVE. You can also call our nutrition clinic at 608-256-1901, extension 17387, to learn about upcoming classes and enrollment options. Again, to participate in the MOVE program, contact your primary care team or call our nutrition clinic at 608-256-1901, extension 17387.
Thanks, Kristen. That phone number one final time for our nutrition team is 608-256-1901, extension 17387. For our last presentation, we welcome in Chad Casey from our patient advocate team, and he's also an Army vet, to tell us about how you can provide us valuable feedback after your appointments.
Hello, I am Chad Casey, and I want to share a tool we use to gather your feedback to make sure we're providing the best health care possible. It's called SHEP, which stands for the Survey of Healthcare Experiences of Patients, and it measures the veteran's experience across care settings. It also allows us for direct comparison of care between the VA and private sector. In short, it provides us a complete picture of what veterans think about their experience. It is a confidential survey that many of you receive in the mail after a visit to one of our clinics. And while it might seem like just another form, it is actually one of the most powerful tools we have to understand your experience and make changes. Your feedback through SHEP tells us what we're doing well and where we need to do better, whether it's how easy it was to get an appointment, how respectfully you were treated, or how clearly your provider explained your care. Every response helps us to see your experience through your eyes. We use this information to guide training, improve communication, and make system-wide changes. For example, if a veteran tells us they're waiting too long to be seen, we look for solutions and dig into that. If you say your provider listened carefully and explained things clearly, we celebrate that with those providers and teams. So when you get the SHEP survey in the mail, I encourage you to take a few minutes to fill it out. Your voice matters. Please know that this survey may come several months after your appointment. So if you have information to share, we suggest you write down notes about your experiences so you don't forget. It helps us honor our commitment by providing you with the best care possible. Care that is veteran-centered, respectful, and responsive. Thank you for trusting your care, and thank you for helping us get better every day.
Thanks, Chad. That's it for the presentation. Now it's time to move into the question and answers portion of our call, and I do owe an apology to Antoine and Melissa, who were both in our queue, and I got trigger happy on the laptop and accidentally sent you back into the call. So everybody will have an opportunity at the end, if we don't get to your question, to leave us a voicemail and we can get back to you. So Antoine and Melissa, I expect a voicemail from you all. I apologize. I disconnected you from the queue. It was not intentional. We can see your questions on our screen, but we'll ask you to repeat it so others can hear it, and then we will respond. Please avoid disclosing personal health information. We want to make sure we protect all veterans' privacy as we answer your question. So our first question is going to be Warren in Watertown. Warren in Watertown, go ahead with your question.
Yes, Warren from Watertown. I'm a 23-year retired veteran, 4 years active duty, and I always get told by the VA offices, like the one in Jefferson and one in Dodge County, that since I was never in combat, I'm not eligible for any benefits to speak of. Like my legs aren't that. If I lost some mobility, they wouldn't build a wheelchair ramp on my house, and stuff like that. They're saying that to have a wheelchair ramp built, I'd have to be combat related. And I'd like to see my veterans pay go up.
Thanks, Warren, for your question. And we actually have our VBA staff online from Milwaukee joining us. And I think Andre said he's going to take that call. Andre, are you on the call?
Yes, can you hear me?
Yep, go ahead.
Hey, hi, Warren. This is Andre from the Milwaukee Department of Veterans Affairs. Just a few quick things. You won't know if you are eligible for the disability unless you file. Just because you didn't deploy doesn't mean that you don't have any disabilities that's related to service. So I'm not sure if you were on earlier where he gave the information for the Vera phone call to schedule a Vera appointment. Would like to speak with you privately about this. So you can either go to the Vera website or just call the National Call Center at the 1-800-827-1000 and ask them to schedule an appointment here with the Milwaukee Regional Office. It'll be all virtual.
I understand that. I made those forms up before, sent them in, and they say since I wasn't in combat, I wasn't exposed to Agent Orange and stuff, that my disability isn't military related. But there is something in the VA pamphlets that talk about out of duty disabilities. The way I see it, a veteran's a veteran, and when he's disabled, he needs some help, whether he's in combat or not.
Yes, so we encourage you. We encourage you to still file a claim because you won't know unless you file. But yet, I would like to kind of speak with you privately about the situation. So, if you can make a virtual appointment with us, I will give you a call and we can discuss this further.
Awesome. Thank you, Warren. Also, thank you to our VBA friends in Milwaukee for joining us remotely. That phone number that Andre mentioned for VBA, again, is Warren, is 800-827-1000. Or if you do if you have access to the internet, you can search for VBA Vera, VERA, and that will take you to the website to be able to schedule an appointment with them. So, thank you.
Yes, and just one more thing. This is just for the general audience. And that's for everyone. So if you feel that you have a condition that's related to service, whether you deployed or it was all stateside, we do encourage you to file a VA claim.
Awesome. Thank you. All right, our next question, we're going to Poignette. Am I saying that right? I'm not a Wisconsinite. Poignette. Sorry. Anthony in Poignette, go ahead with your question.
Yes. This is Anthony from Poignette.
And go ahead with your question.
What is the procedure for acquiring and continuing long-term VA health care services if I should decide to move outside of the continental United States?
Hi, Anthony. This is Liana Torres. I am the Chief of the Health Administration Services. For care outside of the United States and its territories, the VA can only cover care for service-connected conditions. We have the Foreign Medical Program, which is managed nationally. There are 3 ways to enroll in the Foreign Medical Program. One is online, the other one is by mail, and the other one is by fax, and I will connect with you after the call to give you that information. But I wanted to let you know that once you're properly enrolled in the program, they will mail you an authorization letter listing your service-connected conditions in which you will be authorized to receive care for, and then, again, it works in a base of reimbursement. Thank you.
Okay.
Thank you, Anthony. Thank you, Liana. Our next question, if we're staying here in Madison, Mel in Madison. Mel, go ahead with your question.
Hi, I had surgery over a year ago, went through the whole process of paying who needed to get paid, that the VA wouldn't pay and I had to pay, and that was over a year ago. I've heard nothing, and now I get a bill this week asking for over $4,000. How long do they have to bill me?
Hi, Mel. My name is Charisse. I'm a nurse manager in community care. I'm sorry to hear that you're getting bills. I know that can be pretty stressful. There's a variety of reasons why bills can go unpaid by our third-party payer, which is called Optum. If you can stay on the call and leave your name and number, I'd be happy to look into this further for you. Typically, we can identify the reasons why you're getting billed, and then we can usually resolve those pretty easily.
Thanks, Mel, for your question. Our next question, again, staying here in Madison, Myra from Madison. Myra, go ahead with your question.
Okay, this is actually, I'm from Reedsburg, but this is Myra. I have a question about transportation. Some of my transportation that the VA supplies for me out of Madison so I could get to my doctor's appointments, back and forth from my place to Madison. I was wondering if there is some other way of getting hold of the transportation department, because the extension number I have, nobody answers the phone. And that. So I was wondering if there is some other way besides the phone. If there is just the phone, you know, what other extension numbers there are, and if there's also another way of getting hold of transportation to schedule a ride.
Hi, Myra. This is Liana Torres from the Health Administration Services. I also oversee the transportation department. I'm sorry that you're having difficulties getting a hold of us. The main number is the hospital number, 608-256-1901. That is
Okay.
608-256-1901, and the extension is 11919. 11919.
Okay.
It's the main extension for veterans. If they don't answer, it will go to voicemail, and you will be able to leave your message. However, I will advise you that if you have a transportation need, you should be trying to get a hold of us at least 5 days prior to your appointment, to give us the time, to get to the voicemail and then try to coordinate that for you. Thank you.
Okay, because I have an appointment that is very important in 2 weeks, and all last week I have been trying to make sure that I do have a schedule right, because they they scheduled a ride, but they did not schedule a time to come and pick me up last time. So I had to cancel my appointment and reschedule it. But this other appointment that's coming up in 2 weeks is my 3-hour appointment with infusion and oncology for my cancer medication that I take. And that's some appointment I cannot reschedule.
I'm sorry about that inconvenience, Myra. We will call you after we're done here, and then look into the specific situation.
Thank you, Myra. Thank you, Liana. Our next question, we're still staying here in Madison. Robert in Madison, and I apologize, it says that you're on your lunch break, so you might not be there, but let's see if you're online. Robert in Madison, go ahead with your questions.
Yeah, no, I'm here. I was just curious because I'm curious about some of this information, but I never got like an email or a phone call like giving a heads up that this was going to happen today. So I was just thinking in the future if that would be possible.
Yeah, so you're talking specific about these teletown halls?
Yeah.
Yeah, so the way it works is we randomly call 10,000 of our veterans, so not everybody gets the call, and it truly is random.
Okay.
And then you get the invitation 24 hours advance notice, and then you'll get the actual call to join the town hall, on the day of the event. But we will usually post ahead of time, usually at least a couple weeks, on our Facebook page and our website. You can actually register ahead of time to ensure you get called for these town halls.
Okay.
We do them. Yeah, we do them quarterly. The next one is September, I believe. But if you go to our main website on the left-hand side, click on events, and you can see when we have those scheduled. And usually it is a couple of weeks in advance. We'll have the link for you to register ahead of time to make sure that you get the call.
Oh, Roger. Yeah, I just like I said, I don't really go on the website or Facebook that often, so I appreciate it though.
Sure. And another option for anybody else who wants to listen after the fact, we do eventually upload the calls to our website, so you can actually listen to the entire call in its entirety and critique my bad moderating skills if you'd like. So our next question, we're going to Watertown. Michael in Watertown, go ahead with your question.
Yes, I have a question to see if it's possible. Whether you come in for surgery or lab work, is there any way they can tell you that you have to have a urine sample when you get there? I drive over an hour to get there, and I was always brought up and brought my kids up that you go pee before you leave. And it's hard when you get to the VA, all of a sudden they say you need a urine sample, and if you're on a, where you can't drink or eat for 12 hours, it's pretty hard going if, so can they let you know before when you come into your appointment you're going to have to give a sample?
Hi, Michael. This is Erin Mullen in primary care. I have a 4-year-old, and we have that rule at my house as well. So I hear you. Regarding the fasting question, we used to routinely send letters from primary care that you needed to be fasting before labs. It is very rare that you are not allowed to eat before labs now. So I would basically scratch that off of your list of general rules. It is okay to eat. If there is a specific test, they will tell you that in advance. Otherwise, assume you're okay to eat before labs. And then as far as the urine test is concerned, when they schedule those appointments for you, you can ask if there are lab orders associated with that appointment, and then specifically if you're going to need to give a urine sample. For most diabetic patients, that's a pretty routine thing, or patients on specific medication. But it's not a hard and fast rule. So I would just ask when they're scheduling that appointment, and they should be able to clarify for you.
Well, that's not necessarily true, because I have asked in numerous times, and the person doing the scheduling says, I have no idea.
Well, I'm sorry, Michael. Most of the schedulers, when they have an order to schedule an appointment, there are some comments from the staff asking for the appointment indicating if labs are needed. If you're asking and that person isn't sure, I would ask if they could transfer you to someone in that department that could answer that question for you. I also am in primary care, and we field questions from everybody about all things. And if you have My HealtheVet, you could certainly drop a message to your primary care team and ask if they could look into it for you as well. We'd be happy to do that.
Sorry, Michael.
I got trigger happy again. I cut you off there. Thank you for your question, Michael. All right, our next question, and also correction, our next Teletown Hall is June 11th. June 11th is the next one. I was thinking it was September, so be on the lookout for that information for that coming out as it gets closer. Our next question is from Bruce in Beloit. Bruce in Beloit, go ahead with your question.
Yes. I'm a Vietnam era veteran, 25 years, retired. I used to always receive travel pay to get from Beloit up to Madison all the time. Now all of a sudden, I receive no travel pay. Always put in for it, but I never receive it. Why?
Hi, Bruce. This is Liana from Health Administration Services. I'm sorry that you're having difficulty collecting your travel pay. The only thing that I can think of is that you're sending paper claims, and then there is a little bit of a wait time to process those because they have to be manually entered into the system. We have an electronic system.
I put it in on the computer.
Okay. Well, then we will have to call you after the call to see what the problem is. If you were just cut off, it could be an issue with your bank account. Sometimes veterans assume that when they change their bank or information to receive their compensation check. Well, then we will have to, Mr. Bruce, we will have to call you after this and then troubleshoot to see what the problem is. Well, I promise you that we will get to a solution.
Okay, thanks.
Man, I am really trigger happy today. Sorry, Bruce, cut you off in mid-sentence. But again, for you and for everybody else, you'll have an opportunity to leave a voicemail at the end of the call. So if we didn't get to your question, be sure to leave that. And that allows you to leave some more personal information, even though we don't want you to leave a ton. So that way they can look into your situation specifically. Our next question is from Andrew in Madison. Andrew in Madison, go ahead with your question.
Yeah, I have a question. Why is it on the surveys they don't ask how long you have to wait to get an appointment to see your either provider or specialty like ortho to get an appointment? And the second question is, how come our providers are so overwhelmed with veterans that it is very hard to get an appointment to go see your provider? And actually, I just thought of a third question. Sorry. How come they don't have like a VA urgent care on the weekends?
Hi, Andrew. This is Erin Mullen from Primary Care. I can try to answer all three of those questions for you. They don't ask how long it took. We track that data internally on how long the wait time is for you to get in, especially to get in to see your primary care provider. The survey asks, I believe, just how happy you were with the amount of time you had to wait for your appointment, but it doesn't specifically ask you to indicate how long you waited.
Okay.
And then as far as how long it takes to get into the specialty clinics, the general rule is that if you can't be seen in a specialty clinic within 30 days, you would be offered to go out to one of our community partners for something called community care.
All right. Let me just say something real quick.
Sure.
I just recently, I'm having problems with a surgically repaired knee. And I tried to call ortho to get in to get seen for it. And I know I have a return visit, and the earliest I could get in to see him is in May. I just saw my therapist yesterday. I do have swelling around the surgically repaired knee, and I do have fluid in there, and there is pain. And he just recommended me to call them and ask them if they can double book an appointment or see if I can get put out in the community, because I'm waiting now from, March to May to get in to see them about a need that I think I need to get seen earlier.
Sure. So if you're waiting longer than that 30 days, that is the cutoff point for us to send you out to one of our community partners. It may have been that routine appointment you're coming in for in May was something they thought would have been an appropriate timeline based on your last appointment. It sounds like things have changed and your therapist thinks that you need to be seen sooner. I would 100% recommend that you call the orthopedics clinic and tell them what's going on. They may have you talk to one of the nurses in orthopedics and see if they can get you a sooner appointment.
Okay. So, and then how come our providers are so overloaded with vets that it is hard? Because sometimes when you call to get an appointment with your provider, that it seems like it takes either weeks or months before you get to see your provider.
Yeah, Andrew, I wish I had a short, succinct answer for you about that. I think every clinic, has a certain amount of patients that they're seeing. Some of those specialty clinics, the amount of patients they're seeing, the amount of surgical cases waxes and wanes over time. And so, our wait times for different clinics in different areas always varies.
Okay.
And what I will say is that we are here for you 100% of the time. If you're having difficulty accessing a specialty service or you're not hearing back, please come back to primary care. We are happy to field those calls and help you work towards a solution, even if that's seeing us as a stopgap measure until we can get you in with specialty. But we do have staff here that want to see you, so please reach out.
Excellent. Perfect timing. That's the top of the hour, so that's all the time we have for questions this afternoon. If we didn't get to your question, please stay on the line because in just a moment you'll have the chance to leave us a voicemail with your questions, comments, or feedback. And please be patient. It does take us a couple days to get through all the voicemails and get them sent to the correct staff to get back to you. So be patient, but we will get back to you. We very much thank you for your service, and of course, thank you for joining us today.